Hello, and thanks for joining us for this video case tip on the concept of a medical home. I'm Bryn McBride of ABC for Health. Our focus today is narrow. We're not going to spend a lot of time going over all the specifics and the variables involved in a medical home, especially for children and youth with special health care needs. We're going to zero in on one aspect, keeping coverage in mind when talking about care. We have a couple resources that might be useful to you. You can visit those at any time by clicking on that information button you see at the bottom of your screen. Let's refresh our memories to start on what we mean when we say a medical home. Well, it's not an actual building. It's not a place. It's a concept. It's a trusting partnership between you, your child, or the patient involved, and a pediatric healthcare team. If we're talking about adult, we'd be talking about the care team surrounding the adult and any family members that might be involved in healthcare decisions as well. If we're narrowing our focus today to talk just about children, we're talking about family members or parents, the child himself, and the pediatric healthcare team. In a medical home, the healthcare team can help you and your child access and coordinate primary care, but also specialty care. They can also talk over things like educational services, in-home care, family supports, or other community services. This is a great relationship where parents and providers and the patient or child himself can have an open conversation about the best shared plan of care. But don't forget coverage when you're having those conversations. This is where we usually see some of these conversations come through our door at ABC for Health. When there's a question about who are the payers for that primary care or that specialty care or some of those community services? Are services being provided in network? Are you in an HMO and you can't go outside of that network to get the specialty care that's required? Or maybe there's a prior authorization process needed to be able to go outside of network or to get that specialty care. Maybe a letter to the insurance company is necessary. What about coordinating Medicaid and in-school services? And what about care or coverage transitions? Is somebody turning 18? Is somebody turning 19? Does somebody plan to move? Is the family going to be moving because of a change of job, which means you might be uprooting that family, not only from their medical home, but from their insurance plan? These are the kinds of conversations we have with families. We want to keep the concept of the medical home and that relationship with the providers, the family, and the child himself together as we're talking not just about care, but also coverage. There are so many variables, but we know the benefits of a medical home, then they speak for themselves. Focuses on the whole child, not just one question or one issue at a time or one problem at a time. Focuses on the needs of the whole child and the family. The family and the child are involved in the decision making. Mutual respect exists among all of the parties. People are listening to one another in a medical home environment. There's a certainly an amount of respect for different cultures and traditions and mind frames and mindsets about how care should be delivered. And a plan of care with the child, the patient, and the provider is developed. And you probably are very familiar with shared plans of care. We would suggest having the conversation about a shared plan of coverage at the same time. You don't want surprises. When people get surprised most, it's because of network restrictions or cost or unexpected costs or a bill that comes in the mail when you thought you had the conversation about care for the child, but no one ever mentioned how it was going to be paid for. These are conversations you can have in your medical home team and save yourself a lot of stress or confusion or cost later. There are some resources in your community. We're going to share a couple links with you in a second. But consider referrals to regional centers for children and youth with special health care needs, to other organizations. HMOs themselves have member advocates and ombudsmen. Then you can also always make a referral to ABC for Health and we can have this conversation together. And we share a couple of those websites for regional centers, ABC for Health, and a couple other resources that might be helpful. Our top link that you'll see once you click that information button is a brochure that was developed by the Medical Home Initiative that you can have and take with you and print and share with your medical team and your care team for your child. That explains the concept of medical home, but keep in mind you might have to handwrite in there, keep coverage in mind as well. Thanks for joining us.